Turning now to our Medical Monday, talking about a tough topic, childhood cancer. September is Childhood Cancer Awareness Month. An oncologist with Amplify by Gunderson says the disease is both rarer than in adults, but also somewhat common in that about 1 in 285 children will develop some form of cancer before the age of 20. Now, despite that, the outcomes have come a long way.
I think childhood cancer treatment surely is one of the examples of miracles of modern medicine. You know, if you go back to the 1950s, unless it was a type of cancer that could be taken out with surgery and then, hopefully you got it all, it was almost a universal death sentence back, in the 1950s, 1960s. By the 1970s, they had improved survival rates to over like 75%. And now, if a child walks in our door with cancer, it depends on the diagnosis, but the survival rates are approaching 85% at 5 years for all kids diagnosed with cancer.
Dr. Tony Peters says it's a misconception that you have to visit a specialized center to get proper care, adding that our local hospitals can provide treatment for most forms of childhood cancer.
And the thing about childhood cancer treatment is that it has been very coordinated across the country and even across the world for many decades now, because most hospitals started collaborating a long time ago so that we could make quicker progress with research trials than any one institution would be able to do at a time. So because of that coordination, especially for the most common types of pediatric cancer and most new diagnoses, the treatment a child would be offered here in La Crosse is the same as might be offered at a place in Texas or New York or wherever.
Dr. Peters adds that while factors like exposure to radiation and prematurity can increase risks, right now there are no known environmental factors that cause childhood cancers.